Hi everyone, Dr. Brian Steiner here at Wilkins Spinal Care, back with another educational video for the week that we'll post on Facebook. Just to recap the last couple weeks. 2 weeks ago I introduced a new format to the videos, and we started by talking about what is chiropractic. Last week we talked about the nervous system and what it does. Now, why am I doing the videos like this? So I want to re-emphasize what chiropractic is, what chiropractors do, and what the average chiropractor is doing in the office. So if you have any questions regarding the last couple weeks, please feel free to send me a message. I'll catch you up to speed. But for today's topic, it's going to be a lot less extraneous than last week. Last week was a lot, I know. This week's a lot more laid back for you guys. So today we're going to talk about the 3 phases of chiropractic care. The 3 phases of chiropractic care are pain relief, stabilization, and wellness care, all in that order. So let's talk about the first stage, which is pain relief. So patients walk into our office in pain. My job as a chiropractor is to get you out of pain as quickly and as efficiently as possible. And that may take many visits or might not take many at all. A lot of patients will ask, how long is this going to take me? Well, it just depends. A lot of patients feel relief in 1-2 visits, just like that. And then there's other patients that take 20-30 visits. It really depends on your condition and your pain tolerance. Essentially, a lot of patients have different pain tolerances. So again, our job is to get you out of pain as quickly and as efficiently as possible. Once we get you out of pain, that's when we bring you to the second stage, and that's your stabilization stage. In this stage, patients like, I feel good, I'm out of pain, but why do I need to keep coming back in? Well, any wrong lift that you make, any wrong turn that you make can set you back into pain, and we don't want that to happen. Even though you're out of pain, it doesn't mean that you're stabilized yet. We need to strengthen the muscles. We need to strengthen the nervous system even more to ensure that you won't get into any pain by any activity that you make. Now, how long does this take? Again, it really just depends on the patient. A lot of patients who respond quicker tend to stabilize quicker. A lot of patients who take longer to respond take longer to stabilize. It really just depends on their condition. So once you're out of that stabilized stage, we get you into wellness. What wellness is? I like to think of wellness care as getting an oil change in your car. About every 5,000 miles, a car needs an oil change. Without that oil change, a car can't go anywhere. Think of yourself as the car and the chiropractic adjustment as the oil. That adjustment gets you going, and it allows you to do the things that you want to do in your life without having so much wear and tear on your body. Now, how often do you need to come in for wellness? Most chiropractors say anywhere between once a month or even every 2 weeks. It just depends. Here at our office, we have a wellness plan that entitles you to come in as much as you want, as long as you paid for that wellness plan. It just really depends on how you're feeling. So how do we correlate all this into our office? Again, patients come in, they're in pain. We get you out of pain as quickly as possible. Once we get you out of pain, you're stabilized. Now, how we do at our office is we think of it like a doctor, like a PCP doctor. And you may come to your PCP just for a checkup, but you might not need anything done to you. They just want to make sure everything's right. There's going to be times when you come into our office, we won't adjust you because your body doesn't need it. You're stabilized, but we want to check to make sure you're stabilized. So that's how we do it. And then once we get you off a treatment plan, again, a lot of treatment plans are different. Some patients have 10, some patients have 20, some have 30. It just depends. What we do once that treatment plan is over, we get you on that wellness plan, which entitles you to those visits that you want. So that's the 3 phases of chiropractic care. Definitely a lot easier than last week. Again, if you guys have any questions, please feel free to send me any comments in the Facebook page, and I'll be happy to answer them for you. So, next week, actually, I have a treat for you guys. I'm going to do another video tomorrow. I want to talk a little bit about a treatment plan real quick. There was just nowhere else to squeeze it into another week. We don't need to spend the whole week on it. It's just probably going to be like a 2-3 minute video. I'll talk about treatment plan real quick. And then next week, what we're going to do is we're going to talk about patient communication and report of findings. I know it's not super interesting, But a lot of patients want you to know we're there for you. We're going to communicate to you as best as we can so we can give you the best care possible. Once we go off of this topic, I'm going to start getting into the cooler stuff. Neck pain, carpal tunnel, stomach problems, whatever you guys want me to talk about. That's what I'm going to start getting into. I think it's time that we start diving into that. But as far as sources for today, I don't have any because it's more of a chiropractor's opinion. Most chiropractors go by this format, but there's no research done. It's just how it's always been done. So if you do have any questions, please feel free to call me, text me, whatever, and I'll be happy to answer those. I will see you guys tomorrow with another video, not as extraneous, just real quick and simple. Have a great day, everyone.